Dear graduating students, family members and friends, dear members of the faculty and the entire Harvard School of Public Health community, I am here to give you a very warm welcome, literally. But it is my great pleasure to be among the first to congratulate you as you move from being Harvard School of Public Health students to becoming Harvard School of Public Health alumni. Congratulations. Congratulations also to the new graduates' families, friends, teachers, and mentors, to all of you who made this day possible. This is indeed a joyous occasion. At the same time, we cannot forget the fact that it takes place in the shadow of tragedy. The terrible events around the Boston Marathon reveal both the best and the worst of human nature. But let's focus on the best. Let's focus on the first responders and the impact of leadership and crisis preparation, both central to our work and mission here. We are proud of and grateful to HSPH faculty, alumni, and students who contributed to what is now recognized as an extraordinary example of crisis response. What made the Boston response so effective was that it brought together the desire to help with impeccable preparation. The training kicks in is how one first responder explained his behavior after the bombs exploded. The training kicks in. Whether your goal is to combat infectious diseases, reform health systems, or respond to emergencies, preparation is essential to success. And as you embark on this new chapter of your public health career, my greatest hope is that Harvard School of Public Health has prepared you well for the challenges you will face. The class of 2013 is outstanding in many ways, some clearly evident now, others that will only come to light in the course of time. Altogether, 558 of you are receiving degrees today. You come from all over the world, from 74 countries and from 30 states in the United States. All of you are joining the ranks of remarkable individuals who have made history. Let me tell you about one of them. In 1917, this school, then known as the Harvard-MIT School for Health Officers, awarded a certificate to a young woman named Linda James, making her the first female to receive a Harvard University credential on the same terms as her male classmates, one of the many historic firsts for what is now Harvard School of Public Health. Today, more than 56% of you receiving your degrees are women, a testament to how far we have come over the past century. Today's graduates are receiving a wide range of degrees reflecting your wide-ranging goals and interests. 31 doctors of philosophy, 2 doctors of public health, 69 doctors of science, 280 masters of public health, 167 masters of science, and 9 masters of arts. 17 of you will be continuing on with us to earn another degree. Already, you have made substantial contributions to public health. You have worked to decrease maternal mortality in Tanzania, provided mental health services in Haiti, explored the roots of childhood obesity and the impact of neighborhoods on health, conducted basic research relating to malaria and cancer, and engaged in countless other projects as wide-ranging as they are important. Many of you have also made profound contributions to the Boston community. I recently learned that nearly 24 HSPH students provided tutoring to local area public school students during this past year, also raising money through grants to support these efforts. And I suspect this is just the tip of the iceberg. I am so proud of and grateful for all you do to make the world a better place, whether you are thousands of miles away or just around the corner. In public health, as you well know, everything is connected, and every effort counts. There is also another distinction, one that all of you share. You are graduating in 2013, on the cusp of our centennial year. What is now Harvard School of Public Health opened its doors in September 1913, collaborating with MIT to launch the School for Health Officers. It was a time of exciting transformation in public health, with new discoveries relating to sanitation, bacteriology, and the emergence of the new field of scientific epidemiology. And the young School of Public Health was at the center of it all. A century later, we find ourselves in another time of rapid transformation. Global travel, technology, and globalized markets have all contributed to creating a world with unprecedented levels of interconnection and interdependence. A disease that starts in Asia or Europe can travel to Africa or the US in a matter of hours. With the globalization of fast food, smoking, and urban pollution, we are seeing soaring rates of chronic conditions such as diabetes, cardiovascular diseases, and certain cancers. Healthcare is increasingly costly and unevenly distributed. While the wealthiest among us are living longer and better than ever before, the poorest lack the most basic care and often die as a result. Healthcare systems are also more complex than ever before, and the need for understanding public health leaders to run them effectively has never been so great. At an alumni event last fall, Harvard University President Drew Faust spoke of this being, and I quote, a public health moment. For the reasons I just described, this is absolutely true. There has never been a time when the field of public health was so filled with both dangers and possibilities, a fact reflected in the world-changing work of so many of our alumni. One of the most notable is Donald Hopkins, current Vice President for Health Programs at the Carter Center and one of the world's foremost experts in disease eradication. After receiving his Master's in Public Health here at HSPH in 1970, Don went on to play a key role in the global elimination of smallpox and is now focused on the eradication of guinea worm, a parasitic disease so intensely painful that it's been dubbed the fiery serpent. The goal is within reach. When Don began his work in 1986, there were 3.5 million guinea worm cases. Today, there are fewer than 600. Donald Hopkins' contributions were recognized earlier today when he received an honorary degree, the highest recognition accorded by Harvard University. But if we live in a world of great opportunities, where it is possible to triumph over diseases that have plagued humankind for centuries, we also live in a world where the risks have never been greater. During the years I served as Secretary of Health in Mexico, I kept a quote from Winston Churchill on my desk. While the language is a bit dated, a little bit sexist, the sentiment is still valid, and I apologize for the gender bias, but this is the time when Winston Churchill was writing. And let me quote. He said the following: "To every man, there comes in his lifetime that special moment when he's figuratively tapped on the shoulder and offered a chance to do a very special thing unique to him and fitted to his talents. What a tragedy if that moment finds him unprepared or unqualified for work which would be his finest hour. What a tragedy if that moment finds him or her, we would say today, unprepared or unqualified for work which would be her or his finest hour. This idea haunted me. I was so afraid that I would fail to rise to the many challenges of my position. I knew that I had been entrusted with a unique opportunity to effect change, and I was determined to do everything I could do to assure this did not go to waste. I still have this quote on my desk here at Harvard School of Public Health. The paper is yellowed, but I still read it every single day. As Secretary of Health, my central commitment was to the people of my country. As Dean of Harvard School of Public Health, that commitment is to students. And every day, when I read the Winston Churchill quote, I think of you. I think of how we've been entrusted with preparing you for work uniquely suited to your special talents, for what will be your finest hours. Nothing is more important to me or to the future of public health. Being prepared doesn't mean you won't feel uncertain. I've never gotten beyond that myself. You likely won't either. What it does mean is striving every moment to develop the skills and knowledge that will allow you to give the very best of yourselves. Progress isn't created by programs and policies. Progress is created by people. That is why public health leadership has been a central focus of my deanship. On the surface, leaders look very different. They are women and men, old and young, of all races, nationalities, and religions. They have diverse goals, diverse styles, diverse strategies. That said, all leaders share certain attributes. Some of the most important are versatility, knowledge that's both broad and deep, the ability to articulate a personal vision, and interpersonal skills such as collaboration and persuasion. The advantage of versatility is reflected in the remarkable career of today's remarkable commencement speaker, Larry Brilliant, about whom I'll have more to say shortly. What we need are T-shaped leaders, leaders with knowledge that is not only deep in a few areas, but also extends to many. Still, it's important to remember that while leaders share certain attributes, no two are alike. Every one of you has a path that is yours and yours alone. Today marks the end of one chapter of your connection to this school, but it is the beginning of another. As graduates of Harvard School of Public Health, you join our vibrant community of more than 12,000 alumni. In this way, you will continue to belong to us even as you leave our campus. This has always been true, but never to the extent that it is today. One reason for this is the birth and rapid growth of online learning platforms and the virtually limitless opportunities they present. Last fall, our school offered one of the first inaugural courses on the edX learning platform jointly launched by Harvard and MIT. The class in biostatistics and epidemiology drew more than 50,000 students from all over the world. And our second course, Human Health and Global Environmental Change, is meeting a similarly enthusiastic welcome. It's been said that the current innovations around online learning signal the greatest revolution in higher education since the invention of the printing press. Never before have we been able to spread knowledge to so many so quickly. Online learning will never replicate the experience of learning in a living, breathing community of people committed to a shared mission. It will, however, vastly expand the universe of what we are able to do and how and when we are able to do it. Looking ahead, I urge you to take advantage of this unprecedented opportunity once you graduate. This might mean participating in broadcast quality webcasts from our state-of-the-art leadership studio, whose programs have been viewed by more than 250,000 times in more than 190 countries and territories around the world, and which many of you attended in person during your time as students. Or it might involve taking a class through one of our continuing education programs, or through edX, or even serving as a sort of virtual tutor, as we envision alumni eventually doing, helping students around the world get the support they need. Another factor that will support your ongoing connection to this school, to your school, is a growing awareness of the importance of lifelong education. It used to be that education was seen as a sort of a tunnel. You entered on one end and emerged, finished, on the other. Today, the model is different. We have come to see that education must be a never-ending process and that there will be multiple entry points throughout one's career. Our programs for ministers of health and finance are excellent examples of this. The women and men who attend these courses have already reached high positions in their respective countries, and yet they are eager to return to the university, pursuing the path of lifelong leadership development. Regardless of where your careers take you, I hope you will feel the same. In a speech that he had planned to give on November 22nd, 1963, the day of his assassination, President John F. Kennedy wrote, and I quote, that leadership and learning are indispensable to each other. I could not agree more. While today marks the conclusion of one stage of your education, you will continue to find new ways to learn throughout your lives. Yes, this is an ending, but it is also a beginning. You, the class of 2013, will always occupy a special place in Harvard School of Public Health history. You are graduating on the cusp of our centennial year, and as we begin our campus celebration next fall, you will be our newest representatives in the larger world. We also hope to see you back, this time as alumni, at some of these festivities. You will be finding your own ways to shape the future of public health. We have done our best to prepare you. Now, we offer our heartfelt congratulations and send you on your way. The British writer George Bernard Shaw wrote that the true joy in life comes, and I quote, from being used for a purpose recognized by yourself as a mighty one. That is what I have found and what I wish for all of you. Looking out into this remarkable gathering, I am filled with admiration and hope. I have no doubt that the world will be a far better place for what you will bring to it. Congratulations. It is now my honor to introduce this year's commencement student speaker, Candy Liang. Originally from Guangdong, China, Candy arrived in the United States right before high school. After studying biology and pre-med at Amherst College and graduating with distinction, she went on to join a global strategy consulting firm. As a business consultant, Candy was clearly focused on issues relating to public health, in particular, seeking to make a positive impact on healthcare through drug pricing. She saw her job as an effort to balance the incentives for innovation in the healthcare industry with the human responsibility to broaden patient access to life-saving drugs. One of the most urgent challenges of our times is finding ways to improve the performance of increasingly complex health systems around the world. And, luckily for the world, this is precisely the area to which Candy has chosen to devote her substantial talents. She came to Harvard School of Public Health to earn a master's degree in health policy and management. Her goal was, as she puts it, to find the sweet spot between private and public healthcare delivery to better provide accessible, affordable, and high-quality healthcare, especially to vulnerable populations. During her 2 years with us, Candy was a student ambassador working with the Office of Diversity and has also been very active in Project Antares, a collaborative partnership between HSPH and the Harvard Business School, which works to identify high-impact public health interventions in a framework of sustainable social entrepreneurship. She devoted her last semester at HSPH to working with a telemedicine company in India, helping to improve its operations so it can provide high-quality primary care to urban low-income residents in northern India. After graduation, she will join Deloitte Consulting in New York City to continue her mission of improving public health through innovation and entrepreneurship. Please join me in welcoming Candy Liang, our 2013 Commencement student speaker.
Thank you. Dean Frank, Dr. Brilliant, distinguished guests, faculty and alumni, parents and families, greetings and good afternoon. Class of 2013, congratulations, we made it! I am honored to stand in front of you today to describe our achievements, celebrate our diversity, and prepare for our journeys ahead. At last year's commencement, Dean Frank, quoting Ralph Waldo Emerson, challenged us to be trailblazers. Dean Frank knew there's no better way to challenge 500 Type A overachievers than a dare. And it worked. I've been pondering Dean Frank's work ever since and tried to determine what does it take to be a trailblazer. Like any good Harvard student, I started with a hypothesis and employed a robust method of evidence finding and logical elimination. So, within the 95% confidence interval, here's what I found about what we've learned on blazing new trails. We learned to set ambitious goals. If you're unhappy with the status quo, don't aim for minor tweaks. Plan for a systemic overhaul. So facing high rates of cancer mortalities in the developing world, we signed on to the World Cancer Declaration to lower not just one, but 11 types of cancer burdens. Seeing high rates of complications after surgery, we didn't just aim to increase the use of checklists, we worked to change the culture of operating rooms. Our school was founded 100 years ago. We come from a long history of ambitious goal setters, and HSPH has made sure that we wouldn't leave without raising the bar. We learned to collaborate. Through numerous group projects, we learned that the best public health solutions are products of multidisciplinary collaboration. For example, in our spring challenge this year, to reduce the number of bicycle accidents in Boston, we needed knowledge on neighborhood walkability from social and behavioral science students, insights on incentive alignments from health policy and management students, and analytical prowess from biostatistics students. Our school was founded as a joint Harvard-MIT program. Facing the enormous challenge in public health at the turn of the 20th century, physicians and scientists worked together to form the first public health school in the US. Multidisciplinary collaboration is in our DNA. And we learned about leadership. I learned it not only through cases or class lectures. I learned it through you, my classmates. Through you, I learned that leadership requires courage, humility, and dedication. When my friend Mary Sando, who's among us today, decided to attend HSPH, temporarily leaving behind her 2 young children and her husband in Tanzania, that is what courage looks like. When experienced physicians work diligently with non-MD students to improve the patient safety, that is what humility looks like. And when my friend Elizabeth Malin, who decided to return to school despite the death of her mother, that is what dedication looks like. HSPH has equipped us with the skills, the knowledge, the tools to blaze new trails. And we owe it to our families and loved ones, our faculty and mentors, ourselves, and most importantly, the people we will serve to do so. Two roads diverge in the wood. We didn't take either, we created our own, and that will make all the difference. Thank you.
It is now my great pleasure to introduce today's commencement speaker, Larry Brilliant. Larry currently serves as President and CEO of the Skoll Global Threats Fund. But this is just the most recent of the many, and when I say many, I mean many, roles he has filled during a uniquely remarkable career. A physician, epidemiologist, philanthropist, and technologist, Larry's commitment to public health has taken him from Indian villages, he lived in India for more than a decade, to Silicon Valley, from helping to run the successful World Health Organization smallpox eradication program in Southeast Asia, to co-founding The Well, a pioneer digital community. Other seminal accomplishments include establishing the Shiva Foundation, an international NGO whose programs have given back sight to more than 3 million blind people in 20 countries, and taking an active role in the WHO polio eradication effort. His awards include the TED Prize, which he received after presenting his one wish to change the world in 2006. The wish, and I quote, to build a powerful new early warning system to protect our world from some of its worst nightmares. Before arriving at Skoll, Larry headed up Google's philanthropic arm. At Skoll, he heads a team with the mission of confronting global threats such as pandemics, climate change, and nuclear proliferation. As former President Jimmy Carter wrote in Time magazine, which named Larry one of the world's 100 most influential people in 2008, and I quote, his humanitarian spirit and grasp of science makes him one of our leading social entrepreneurs. Wired magazine began a piece on Larry with the words, if Larry Brilliant's life were a film, critics would pan the plot as implausible. And you know what? They have a point. As a young man, Larry joined the smallpox eradication efforts under the direction of his Indian guru, not exactly your typical route to a position with WHO. Along with serving as CEO of 4 tech companies, he marched with Martin Luther King, served as a physician to the Grateful Dead's legendary Jerry Garcia, and acted as an extra in the 1971 Bollywood movie Hare Rama Hare Krishna, which depicted hippie culture. By whatever measure you use, it has been an extraordinary life. Now, while preparing to give this introduction, I came across the phrase nominative determinism. Nominative determinism. The idea being that our names can play a role in shaping who we become. If this concept were in search of an exhibit A, Dr. Brilliant would be an excellent choice. But Larry isn't extraordinary simply because of his brilliance, though he certainly is that, but also for his range. Larry's professional trajectory embodies the career plasticity that increasingly characterizes 21st century work lives. Unconstrained by traditional boundaries, whether geographic or disciplinary, he has let his career take him where the needs and opportunities lie. You can overplan things, he said in an interview last year. Some people have 10-year plans. I don't. The best things that ever happened to me, I planned 0 of them. These are the words of Larry Brilliant. While his own life has been an extraordinary one, Larry has a deep belief in the power of ordinary people to effect major change. He frequently quotes Margaret Mead to this effect: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." Larry Brilliant has certainly changed the world, and I am so grateful that he has taken the time to be with us today. Please join me in welcoming Dr. Larry Brilliant.
How's everybody doing out there? Hot? I'm sorry. I'm really sorry. Because this is a really long speech. But I'll talk fast. You know, I really used to like Google a lot until Dean Frank used it to find out everything about me. Dean Frank, Julio, and your family, graduating students of the class of 2013, your families, partners, and friends, Miss Liang for that amazing speech, distinguished members of the faculty, the entire School of Public Health community, thank you for inviting me to speak to you today. I understand you elected me to this position. Thank you for that. I hope I'm worthy of it. I'm also happy to see some familiar faces here, old friends. I just want to acknowledge them. John Brownstein from the medical school. John is working on Flu Near You and new digital surveillance systems along the line of that TED Wish that Dr. Frank talked about, and we're partnering with him. John is also proof that you can have a PhD and do practical things in public health. I particularly want to welcome Andy Epstein. Andy, where are you? You may have known her husband, Paul Epstein, who sadly died a year and a half ago. Paul founded the Harvard Center for Health and the Global Environment. He taught classes here at the School of Public Health for almost 10 years on climate and health. He set the gold standard for combining science, advocacy, and love. Paul and Andy and my wife and I came together when we were interns in San Francisco around the time of the Summer of Love. You may have heard about it in your history books. Coming here today, I've been thinking a lot about those days in the 60s and the 70s when Paul and Andy and I were activists. We dedicated ourselves to change the practice of medicine, to make healthcare work for the poor, the vulnerable, and the weak. We were activists and we were optimists. And all of you here are activists. At some level, you are optimists. Do you remember the first time you decided on a career in public health? Do you remember the germ of the idea of serving the people? Where did it come from? I know the very minute the virus of activism infected me. It was November 5th, 1962. The Reverend Martin Luther King visited the University of Michigan. It was a dramatic time. The world teetered on the brink of nuclear madness during the Cuban Missile Crisis. Federal troops were on patrol after the first black student was admitted at Ole Miss. And Bob Dylan was singing, "A Hard Rain's Gonna Fall." I was a clueless sophomore, locked in my own selfish bubble. Some of you may remember that moment. But I went to hear Martin Luther King that day as he spoke in a way that made us feel that it was our destiny to become activists. We jumped on the stage, we stayed there as his soaring rhetoric and the truth of his life, his example, called everyone who heard him to a life of service. to social justice, a life that for me became public health. A small group of us stayed around after he spoke for several hours, listening to him. We would not let go of him. He said, "The arc of the moral universe is long, but it bends towards justice." He was not the first person to speak of the moral universe bending towards justice. Albert Einstein talked of it. Theodore Parker, a Unitarian minister, was probably the first. Fittingly, he lived not far from where we sit in Boston. Fittingly, he was an abolitionist, a change maker, an activist, a troublemaker, our kind of troublemaker. But when I heard Martin Luther King say that the arc of the moral universe is long, but it bends towards justice, it might have been the anthem of the 60s. It struck home. Everybody who was there that day signed up for the cause. We marched in Selma, Alabama, in Mississippi, in Washington, D.C. We marched for freedom, for social change, for civil rights. We marched against secret wars in Southeast Asia. We had sit-ins and teach-ins. We joined an alphabet soup of civil rights organizations, CORE, SNCC, the NAACP. We learned nonviolence, to sit at the lunch counter at Woolworth's and absorb body blows without hitting back. When I was in medical school, I joined the Medical Committee for Human Rights, which had been started here at Harvard. I put on a white coat with a very ostentatious stethoscope dangling from my side, and I joined a cadre of medical students, nurses, public health activists, and we surrounded Martin Luther King as if our white coats could protect him. One day in Chicago, at an anti-war march, hundreds of us were arrested marching with Martin Luther King. It is such an honor to have been arrested with Martin Luther King. And there were so many of us that couldn't put us in regular jail. They had to make a pretend jail to keep so many of us. Now that's a lesson for those of you activists who are planning to court arrest. Figure out in advance how to get arrested with 500 of your friends. They'll put you in pretend jail. We won some and we lost some, but we successfully stopped the Vietnam War. We passed the Voting and Civil Rights Acts. My generation planted seeds that would later embolden movements for women's rights and gay rights. And yes, we felt indeed that the arc of the moral universe is long, but it does bend towards justice. And that is how I wound up with Paul Epstein and Andy Epstein and half a dozen other activists, deciding that we would all do our internships after medical school in one city and perhaps wreak havoc there. Poor San Francisco, it was hardly ready for us. A few days before our internship started, a glossy, expensive doctor's magazine called the World Medical News put a photo of 5 of us on the cover. They wrote under it, "Watch out, doctors, watch out, hospitals, watch out wherever they will intern. These young revolutionaries are coming. They will destroy your wealth and privileges." I guess they thought that they had detected the ringleaders of a conspiracy, and they were not completely wrong. We believed, unlike the AMA and the establishment at the time, that health care was not a privilege. It was a basic human right. And we believed to deprive anyone of basic health care was immoral, whether you were a clinician or a country. So there was something about inalienable rights and life, liberty, and the pursuit of happiness. I still believe that. Don't you? I looked at that photo yesterday, thinking I was going to see Andy today. I don't believe we looked menacing at all. We were just scared kids, like most of my generation, angry about an unjust war, fighting for civil rights. But the hospital I was interning at, I guess they thought I was menacing. So internships begin on the 1st of July. What I walked into at the hospital on my first day, that magazine picture was everywhere. They had made hundreds of copies of it. They had posted it on every bulletin board in the hospital, each with a bullseye painted around my head. They did not intend that bullseye to be a halo. Several of those bullseyes had a hypodermic syringe stuck in my nose. Below each one was written, "Presbyterian Hospital welcomes its new revolutionary intern, Dr. Brilliant." Oh, yes. Well, maybe it was a coincidence, maybe it wasn't. Instead of the usual interns 24 hours on, 24 hours off, the first rotation I was assigned to was for 96 hours straight, and they put me in the intensive care unit. By the end of working 4 days in the intensive care unit, I was exhausted, I was useless, I was dangerous, I was making lousy medical decisions, and I was absolutely certain the hospital had jeopardized the health of its patients to make a political point. Now, that was a different era than today. On July 5th, the interns issued a press release. On July 16th, we organized an interns and residents union. On July 7th, we went on strike for better patient care. 3 days later, the hospital caved in and agreed to our demands for better patient care. You know, my theme is going to be, that was then, let's make it now. The old guard did not believe that health care was a right and not a privilege. And some of these same forces are around today. Look at Congress trying to undermine, undo the Affordable Health Care Act. They would exclude 45 million uninsured from getting health care for political reasons. Who are these people who value profits over public health? They're the same forces that fought the 60s idea that health was a human right. For my generation of young radicals, though, I think we prejudged the mostly conservative medical profession. We assumed they wouldn't be good doctors because they were out of touch with the great social upheaval of the time. They didn't understand the needs of the marginalized. They didn't see the patterns and linkages between disease and poverty, the relationship between social justice and life expectancy. But the fire that came of that battle catalyzed great expansion in public health, much of which you see here today. New areas of study arose from that ferment. Medical care organization as a field of science just began. Community medicine, preventive medicine, social medicine, all got created. The EIS Corps at CDC and epidemiology itself got a boost because young men had a choice of going in the Army, going to Canada, going to jail, or going to CDC and joining the EIS Corps. And the best and the brightest became EIS officers, and CDC became a major player in the world. Political activism fueled many public health careers. But in those days, we had an alternative to activism. We had the counterculture. You know the famous Alcatraz prison. You may not know that 40 years ago, a band of Native Americans invaded, took over Alcatraz, symbolic of their idea of liberating land that was once taken by the U.S. government from the hands of Indians. One woman, a Sioux Indian named Lou Trudell, who was 9 months pregnant, she was about to deliver a baby in that cold, old prison where there was no water, no electricity, and no medical care. A newspaper columnist wrote a challenge. Is there no doctor who is willing to go and live on Alcatraz and deliver this baby? Of course, I went. I hitchhiked on a local boat. I lived on the island with the Indians for almost a month. I helped Lou deliver the baby. They named the baby Wavoka after the founder of the ghost dance religion. Now, I know there was no real electricity on that cold prison island, but when that baby Wavoka was born on free Indian land, there was electricity of a different sort, a mystical electricity. And it was a deep emotional experience for everyone on that island, regardless of the color of their skin. After I was lifted by helicopter off Alcatraz to dry land in San Francisco, I was met by dozens of TV cameras asking me, what do the Indians want? How could I know? I'd never met a Native American until 3 weeks earlier. Somehow, in a way that I still don't understand, someone at Warner Brothers saw my terrible TV performance and asked me to play a young doctor in a movie called The Medicine Ball Caravan. It was a terrible movie, but it was about the Grateful Dead and the Jefferson Airplane and Dave Crosby and rock bands, and I became a rock doc. I became the doctor, one of the doctors for the Grateful Dead. And if you've heard the expression, you're either on the bus or you're off the bus, I was definitely on the bus. I left medicine for a time to join my dear friend Wavy Gravy's hog farm commune. I traveled on funny painted hippie buses from London to Kathmandu, living for weeks at a time in Iran, Afghanistan, Iraq, Pakistan, India, and Nepal. I lament the fact that you can't take that trip in funny painted buses. It was the trip of a lifetime. My wife and I wound up living in a Himalayan ashram. We lived there for 2 years. I nearly forgot all about medicine. We studied Hindu, Buddhist, Muslim, Christian, and Jewish texts, and we meditated. Now, that was the normal career path in the 60s. This idea of an internship and residency, that was really abnormal. My guru, Neem Karoli Baba, was a wonderful and a very wise renunciate. We all thought he could see the future somehow. One day when I was trying to meditate, he called me. He gave me the name Dr. America. He called, "Dr. America," and he said, it was my destiny to leave the monastery, go to join the World Health Organization team that was being assembled in New Delhi to eradicate smallpox. I had hair down to my knees, I had a beard to my belly, and I was wearing a white gown. I took those off and went down and was interviewed, and after 17 attempts, I got my job, and I became the youngest member of the smallpox eradication program. My guru said that smallpox would be eradicated and that it was God's gift to humanity to lift one form of suffering from our shoulders. It was God's gift, he said, because of the dedication of public health workers. How he knew that smallpox could be eradicated, how he knew that smallpox was a disease, how he knew that smallpox would be eradicated, I'll never understand. I was 27, I had never seen a case of smallpox, and this was my first real job out of medical school. I want you to understand how bad smallpox was, because when you know that that's gone, it will elevate you to think that anything is possible. The first time I saw a village full of people dying of smallpox, it was like an image from Hieronymus Bosch or an engraving of Dante's Inferno. But this time it was real. When I arrived at that village in a big Jeep with a big UN seal on it, a mother rushed up to the Jeep carrying a 4-year-old baby. She asked me, as a foreign doctor, to give the baby medicine. But the baby was long dead, and there was nothing I could do. Everywhere there were children coughing, covered with excruciating lesions, parents standing by helplessly, watching them die. Some places we were told the rivers did not run because they were clogged with dead bodies. Smallpox was arguably the worst disease in human history, one of the biblical plagues. It had killed more than 500 million people. That's not a wordo. 500 million people in the 20th century alone. 24 kings and queens were killed by smallpox. Wealth and privilege could not protect you from a truly excruciating death. Pustules and scabs covered every inch of your body. There were no intensive care rooms, no clinical care, no treatment options, only the fight the next case occurring. 1/3 of the victims died. To eradicate smallpox, we had to find every single case in the world, every virus without exception, at the same time, and put a ring of immunity around it. So that's what we did. In India alone, 150,000 health workers visited every house in India every month for 20 months. We made over 1 billion house calls. That's what separates public health from medicine. We made over 1 billion house calls. And in October 1977, I got to see the last case of smallpox, the last infection in nature of variola major, the end of a chain of transmission of a disease that lasted more than 5,000 years, that had killed Pharaoh Ramses and might have scarred the faces of Jesus' disciples, Moses' disciples, Buddha's disciples. A young girl named Rahima Bano in Bola Island, Bangladesh. When I saw her after her scabs had fallen, and I contemplated that perhaps once when she coughed and the last viruses of variola major fell on the hot, parched land of Karelia village, the last virus died from that chain of transmission going back to Ramses, to biblical times. I cried like a baby. I was so relieved. I was so happy that the demon of smallpox was dead, and I was so honored to be a small part of it. In a way, my life was set. I had not yet gone to public health school. I had not yet studied epidemiology formally. I did not have my MPH, but I knew that I would. And I knew that I would always be a public health worker. No matter how hard, no matter the long odds, nothing could be more noble for me than to do what you're doing right now and joining the field of public health. My mentor was Bill Foege, the legendary epidemiologist who would go on to head CDC, inspired the Gates Foundation's commitment to global health. He crafted the strategy that saved the world from smallpox. Bill took me to see my first cases of smallpox. Now, Bill is very, very tall. He's over 6'7". We would go into villages to vaccinate kids, and we would look for cases of smallpox, but the kids would all hide. Because I spoke Hindi, Bill said to me, "Tell the children that the tallest man in the world has come to their village." I did. They came. We grabbed them and vaccinated them. Bill taught me to take the same sense of personal satisfaction watching the epidemic curve drop as I would have watching the fever chart drop of a child who had a fever. But I had to make that transition internally, as you will have to. Hidden in those dry graphs and charts were the stories of hundreds of thousands of individual life and death struggles. I spent 10 years in India fighting smallpox. I had been the youngest person to work in the program. When the people who really knew what they were doing left or died, and I was left in charge of the program, I had 150,000 people in a program. I'd never been trained in management. Don't tell anybody that. I was the last to leave. I turned off the lights. I packed up the archives. So smallpox was the first and so far the only disease ever eradicated. But there's really good news. I expect that polio, another very ancient disease, will soon follow into the dustbin of history during your careers the first 5 years. Thanks to WHO and Rotary and the Gates Foundation for sticking with polio, despite the murder of public health workers in Afghanistan and Pakistan. And the Carter Center, you heard about my friend Don Hopkins, has had such success in another eradicable disease, another ancient biblical disease called guinea worm, or dracunculiasis, the fiery serpent. Dracunculiasis is written about in ancient Greek and Roman and Christian texts. I think it's going to be a great race to see which of these two ancient scourges will be eradicated first. You're going to watch it. Will it be polio? Will it be guinea worm? There's polio, there's guinea worm, there's polio, there's guinea worm in that. I think it'll be a photo finish. That would be nice. Because if smallpox is the only disease in history eradicated, it will always be an anomaly, an anecdote, a footnote. But if 2 or 3 more diseases can be eradicated, that'll be a huge boost to global health workers all over the world. And then we can go after pandemics. With the new digital disease detection systems like HealthMap and GFIN and ProMed and Google Food Trends and Flu Near You and new governance systems like CORDS that I will tell you about at another time, I have high hopes that we can end pandemics in your lifetimes. And it sounds crazy, but so did the idea of eradicating smallpox or polio. This is another race between the inevitability of pandemics if we do nothing and the new technologies that that could put pandemics in the same dustbin of history where smallpox and polio and guinea worm will hopefully be waiting for them. So that's my story. Today begins your story, your generation, your adventures. And public health is a great adventure. It's filled with so many possibilities. If you want, you can work on a much larger scale than any individual doctor ever could in their lifetime and touch more people than one doctor could in 100 years. Or you can work in a small local health department. Either way, you can find joy and satisfaction in your chosen field of public health. You may fight for animal rights or for human rights. You may work on poor eyesight or mental illness. You may crack the epidemiological or genomic mysteries of cancer or heart disease. You may challenge the government, corporations, or special interests to right wrongs, local or global. You may seek to lessen the burden on the poor or battle to bring water, health care, and education to those who need it. You are a change maker, part of the warp and weft of social change. You are pathfinders. Whether you work on improving the social justice of public health like Paul Farmer, or fight the terrible effects of climate change on health like my dear friend Paul Epstein, you can be a public health hero. When you work on public health, when you choose the noble path of working for the health of the public, you inherit the great tradition of those who came before you. Class of 2013, I wish you amazing, transformative lives and adventures filled with inspiration, hard work, equanimity, and joy. Class of 2013, today you inherit a magnificent tradition and embark on a noble cause. Every day, you'll have the power to change thousands of lives. You'll give hope and health to your communities and to your world, even when the news is bad. In the 60s, when my generation was shell-shocked by the assassinations of Martin Luther King, John F. Kennedy, Robert Kennedy, and the daily death toll from the war in Vietnam depressed us beyond imagination, a San Francisco radio reporter named Scoop Nisker ended every news broadcast by urging his listeners, he would say, "The news today is bad, but if you don't like today's news, go out and make your own." Class of 2013, from today on, make your own news. The narrative of history is in your hands. Class of 2013, new members of the public health community, congratulations. Your teachers, your parents, and all of us who went ahead of you are proud of you. I just have one parting request. Listen up. Whether it was Dr. King or someone else who first imagined the arc of the moral universe bending towards justice, you can be damn sure that they did not mean that history bends towards justice if we all sit on our asses. Look around you. The outside world is far from automatically justice. It is a battle for the poor, a battle for justice, a battle to lift the health of the public. Here's what I ask you. Imagine that arc of history that Martin Luther King inspired is right here with us. It's right here. The arc of the universe needs your help to bend it towards justice. It will not happen on its own. The arc of history will not bend towards justice without you bending it. Public health needs you to ensure health for all. Seize that history, bend that arc. I want you to leap up, to jump up, and grab that arc of history with both hands, yank it down, twist it, and bend it. Bend it towards fairness, bend it towards better health for all, bend it towards justice. That is your noble calling of public health. Welcome. Thank you. Thank you. Thank you.
I can only say that that was brilliant, Larry. I am now delighted to introduce Dr. Elspeth Kalendarian, President of the Harvard School of Public Health Alumni Association. An oral surgeon by training, Elspeth received her master's degree from our school in 1989. She has had extensive experience in the healthcare, human services, and public health fields. Elspeth now serves as Chief of Quality at the Harvard Dental Center and Chair of the Oral Health Policy and Epidemiology Department at Harvard Dental School, where she is an associate professor. Her research interests include patient safety and quality improvement, especially as these issues relate to electronic health records. I want to take this opportunity to thank Elspeth for her years of active service with our alumni community and to encourage you, as I know you will, to follow in her footsteps. And now, please join me in welcoming Dr. Elspeth Kalendarian.
Hello, graduates, family, friends, esteemed faculty, Dean Frank, Dr. Brilliant, that was brilliant, and fellow alumni. It's my honor to bring you a welcome and greeting from the HSPH Alumni Association today. As my term leading the Alumni Association comes to a close, I reflect on the future of our field and the contributions I know you will make to it. As I know you are aware, the school will be celebrating its 100th birthday this fall, and with that at the forefront, I also think of its roots in public health activism and social change and reform. These are fundamental to the nature of the field of public health. While you will enter, or for some of you continue, the diverse professions as physicians, epidemiologists, consultants, policy analysts, academicians, and so much more, I implore you all to consider yourself, above all, ambassadors for the importance of public health. Because right now, as I look around you, I see the future. Class of 2013, you have been selected and trained to save the world as public health ambassadors. You have been led here by an illustrious legacy of HSPH alumni and world savers. Drs. Drinker and Shaw's invention of the iron lung and polio treatment, and Dr. Max Essek's discovery that HIV is a retrovirus have not only transformed medicine and research, but also their incorporation into everyday life. Graduates of this school, I have seen that same flame of exploration, persistent achievement catch on year after year, graduation class after graduation class. Just look at some of the few accomplishments of your recent alumni. In 2010, your alumni were at the scene of the earthquake in Chile, and they are still there, building upon new sustainable health services for the poor. When the earthquake struck in Haiti that same year, your alumni were providing emergency medical care. Your alumni also care deeply about cultural inclusion right here in the United States, whether it's being a medical director at the Navajo Reservation, or ensuring that right here, Boston's bicycle lanes contribute not just to the cardiac health, but also for public safety of our citizens. Whether it's a child's smile, a happy pedestrian, a sustained culture, the diverse beauty of the world is made all the more beautiful by your endeavors. As the public health ambassadors that you have all become today, you have a responsibility to inform and effectively change the world for the better, but by the same token, the world will inform you on the issues that need to be changed for the better. You must take these symbiotic relationships to identify and analyze problems with the health of the world. Take the training with you to wherever you decide to explore and become the supermen and women that this world needs. This school has an illustrious past in its tremendous research advances, but also more broadly in education and shaping the top minds in public health around the world. As you work with patients, clients, students, and colleagues, I urge you to use your discoveries and your knowledge to find new ways to spread critical public health messages. You will all make great contributions in your jobs, but beyond that, I have faith that you will carry the torch of public health service to all four corners of the world. Class of 2013, prove me right when I say that you can change the world for the better. Make me proud. Class of 2013, make the alumni proud. Make the world proud that it is in capable hands. Class of 2013, make the Harvard School of Public Health proud. Make the dean proud. Class of 2013, make Dr. Brilliant proud and deliver on his call to action, as I would like to call it. And most importantly, make yourself proud. A hearty congratulations to you all. On behalf of the more than 12,000 members of the Harvard School of Public Health Alumni Association, I welcome you to our midst and wish you all the best in your futures of public health.
Thank you, Dr. Kalandarian, for those welcoming words on behalf of our alumni, and for all you and your colleagues do in the Alumni Association to make the school proud and to mobilize our alumni to serve the school and our students. The Harvard School of Public Health Student Awards honor outstanding students, generally through a selective nomination and committee deliberation process. Many of you were at the award ceremony yesterday evening, where I had the privilege of presenting the awards. This year we recognized 13 students. I will announce each of their awards and names and ask them to stand in place and be recognized. I'm pleased to announce the following student awards. The Albert Schweitzer Award to Mary Monika Sando. The Fang Ching Sun Memorial Award to Anne-Marie Newland. The Edgar Haber Award in Biological Sciences to Christopher Burton Ford. The Gareth M. Green Award for Excellence in Public Health Practice to Ali Chisti and Jonathan Lichkus. The James H. Ware Award for Achievement in the Practice of Public Health to Adil Khan. The Robert B. Reed Prize for Excellence in Biostatistical Science to Yanyan Chen. The Student Recognition Awards to Amy M. Grace and Harpreet Sood. The Teaching Assistant Awards to Sherelle Monique Spencer-Barber, Nana Kyum, and Emily Sela Zoltnik. And the Uwe Brinkman Memorial Travel Award to Panji Hadisomatu. The Harvard School of Public Health Teaching and Mentoring Awards are based on student feedback through course evaluation questions that focus on quality of teaching and effectiveness in class for the Teaching Awards, and through student nominations and committee vote for the Mentoring Awards. This year we recognize 9 faculty members. I'll announce each of their awards and names and ask them to stand in place and be recognized. I am pleased to announce the following faculty awards. The Roger L. Nichols Excellence in Teaching Award to Arnold Epstein, the John H. Foster Professor of Health Policy and Management. For teaching citations to Heather Bayer, Assistant Professor in the Department of Epidemiology, Teresa Betancourt, Associate Professor of Child Health and Human Rights, Joshua Salomon, Professor of Global Health, and Benjamin Summers, Assistant Professor of Health Policy and Economics. and 4 mentoring awards to Stephen Gourtmaker, Professor of the Practice of Health Sociology, Paul Greg Greeno, Assistant Professor in the Department of Global Health and Population, Jihong Lin, Professor of Biostatistics, and Matthew Miller, Associate Professor of Health Policy and Management. The Harvard School of Public Health Staff Recognition Awards was created by the student government to ensure that members of the HSPH community who are neither faculty or students are acknowledged for their great efforts to help students at the school, specifically staff members who make a significant impact on the lives of students at the Harvard School of Public Health. The award is intended to acknowledge the importance of non-classroom and mentoring activities in the lives of students, and this year we recognize 2 staff members, Donald Halstead, Instructor of Writing, and Fawn A. Phelps, Assistant Director at the Center for Public Health Leadership. And now, each department chair or representative will read the names of doctoral graduates while the chair of the Committee on Admissions and Degrees, Dr. Meredith Rosenthal, hoods the candidates.
I am honored to present the doctoral degree recipients in the Division of Biological Sciences, Prerna Bhargava. Regina Carol Joyce. Karel Gamene Pele.
I'm honored to present the doctoral degree recipients in the Department of Biostatistics, David Michael Swanson. Linda Valeri.
For the Faculty of Environmental Health, I'm pleased to introduce the outstanding scholars who will receive the Doctor of Science in Environmental Health. Callie Chung Yung Chung. Jennifer Lynn Garza. John G. Marianthi Anna Kumutsuku. Xu Yi Thiao. Wei Ji Xiao. Matthew Trudeau. And with the degree of Environmental Health and Epidemiology, Andreas Michael Neofito.
Good afternoon. From the Department of Epidemiology, I'd like to recognize our graduates. First, Elisabetta Paterno. Congratulations. Now our Doctoral of Science graduates, Elizabeth Venteras Arkema. Sarah Ariella Aroner. Yin Gao. Jenny Lauren Carwile. Wei Lun Allen Fong. Linda T. Hariaki. John William Jackson. Sashana Lee. Nicole Anna Middaugh. Jacqueline Lee O'Brien. Justin John O'Hagan. April Opeliner. Christine Kellen Pearlston. Kelesete Fire. Soshana M. Rosenberg. And this is a graduate from Joint Epidemiology and Global Health and Population, Aisha Sana. Christopher Robert Sudfeld. Wei Wu. Jin Xie. Melinda C. Power. Joint in Epidemiology and Environmental Health. And Joint in Nutrition and Epidemiology, Jenny Jiwon Ri. Okay. Go ahead. That's all right? Okay.
So from the Department of Global Health and Population, honored and delighted to introduce the names of our doctoral graduates. Jeremy Theodore Borowski. Nathan J. Blanchett. Jacob Henry Bohr. Simun Choi. Jennifer Michelle Mann. Hiroaki Matsuura. Lina Adnan Mirdad. Carmel Adnan Salhi. And Pamela Scorza. Zubin Cyrus Shroff. Banafshe Siadat.
I'm honored to present the doctoral degree recipient in the Department of Health Policy and Management, Raymond Chunman Chan.
It's my great honor to present the doctoral degree recipients in the Department of Nutrition. Ramadani Stefano Muiro, Paul Vincent Petraro, Andrew Lucian Thorne-Lyman, in addition, degrees in nutrition and epidemiology. Jennifer Lisa Fowl. Ron Zhang. Kisu.
I'm honored to present the doctoral degree recipients from the Department of Social and Behavioral Sciences, Medina Aganor. Mariana Claire Akaya. Congratulations. Nandita Ban. Lauren McCall Dutra. Bernice Ravichet Garnett. Guy Duncan Harling. Davi Alejandro Hurtado. Rebecca Moraid Lee. Michael William Long. Right. I'm pleased to announce the doctoral degree recipients from the Department of Society, Human Development and Health, Nish Akihiro. Amina Andalip Baba Agawamba. Marlene Camacho Rivera. Catherine Lindsay Fowle. Heather Lynn McCauley. Serena Reisner. Sabrina Charisse Selk.
I'm honored to present the Masters of Arts in Biostatistics, Shelley Liu. The Master of Science in Biostatistics, Craig Matthew Bilski. Fei Li. Dale Edward Myers. Chung Chi Wu. Mark Anthony Weimer. and the Master of Science in Environmental Health, Julianne Bacuzzi. Erin Collins. Meryl Danielle Colton. Clifton D'Asunsao. Michael Patrick Grant. Tori Adriana Gerald. Michael E. Chow Lin. Goro Maruno. Wei New. Vanessa Ray Palmer. Molly Frances Reddington. Ping Xiao. Pei Fong Sai. Master of Science in Epidemiology, Azalea Ayunintias. Anna Babicek. Wen J. Bao. Suzanne Jane Barron. Muhammad Farid bin Abdul Rahman. Maxine May Chen. Delphine Sophie Kawasier. Bing Han. Yang Hu. Constantine Jason Cavellas. Alexis Ann Krum. Japneet Quatra. Wen Yuan Li. Yuan Yen Liu. Phillips Cluster Lo. J. Lin Mao. Uzoma Blessing Ononogbu. Nelson Dwayne Pace. Talia Michelle Quandalesi. Andrew Thomas Rothman. Elizabeth Susan Russell. Basma Sufdar. Matthew Charles Stiefel. Claudia Kimie Sumoto Zariki. Mustafa Toma. Dong Hoon Lee. The Master of Science in Global Health and Population, Chi Young Bak. Tara Banani. Karen Biala. Lindsay Lego Boughton. Geethika Ranmali Fernando. Sarah Catherine Jenks. Xiao Zhang. Yu Shan Zhang. Maria Yoeg. Annie Dunleavy Kearns. Karima Ladhani. Yun Fei Li. Xing Liu. Stephanie Sarah Liu. Natalie K. Myers. Natalia Petruski Ivleva. James Richard Potter. Elena Pradhan. Sarah Elizabeth Raifman. Hannah Ratcliffe. Amelia van der Zanden. Laura Jane Vaughn. Hui Huang. Se Huang. Jennifer Brandon Weaver. Master of Science in Healthcare Management, Ghulam Abbas. Riyad Zuhti Abdel Karim. Tobias Douglas Barker. Henry Bernstein. Edward Luke Bold. Asim Nazir Chima. Richard Edwin Chinnick. Michael Joseph Dacey. Michael Dobbs. Lucinda Lee Everett. Danielle Alberto Fuentes Granado. James Nicholas Gilbert. Pablo Ignacio Hernandez Itriago. Ted A. James. Shubjit Kaur. Priti Jasu Lakhani Mena. Hoffman Mokah Lantun. Jose Oberholzer. James Ray Parton. Purvi Shah Malaylil. Alan Silverberg. James Eric Stein. Chipora Strauss. Sheldon George Weiss. Master of Science in Health Policy and Management, Margaret Catherine Anschutz. Melinda Joyce Becker. Henry Christopher Block. John Robert Boney. Akash A.J. Desai. Maya Leslie Fedison. Maura Claire Fulton. Kadir Pursoy. Ravi Joshi. Ann Young Kim. Richard Man Huang. Candy Yi Liang. Junqing Liu. Megan Lorraine Laux. Elizabeth Stephanie Mallon. Haley Bowen Othen. Sophia Pennick. Claire Elizabeth Schreiber. Margaret Diane Sinnis. Suzanne Sheets. Audrey Lynn Stanton. Agnes Elizabeth Reynolds Terry. Molly Elizabeth Warren. Claire Elizabeth Whelan. The Master of Science in Social and Behavioral Sciences, Lauren Elizabeth Bailey. Kenny Chung. Chong Min Fu. Mary Therese Gorski. Alicia Yakim Leilani. Victoria Ayano Ogawa. Rijuta Chandrakant Pandal. Amaya Gabriela Perez Brummer. Martin Reedy. Christine L. Simon. Noemi Jessica Sportish. Young Ju Su. Emily Samantha Nash Zevan. The Master of Science in Society, Human Development, and Health, Ariana Ines Blaine. Kelly Jo Blunden. Yu Fan Chen. Emily Ann Mestrelis. Laurel Andrea Stickler. The Master of Public Health, Hatem Mehmood Shaheen Alawal. Nicholas Ryan Aldridge. Sui Hui Ang. Maya Ari. Denise Abena Asafu Ajay. Alp Atik. Damilola Ibumpun Babalola. David Barros Sierra Cordera. Sando Pana Besa. Fatima Oluwakemi Bello. Kimberly Ann Burtons. Marie Renee Bilojois. Joey Bonifacio. Sam Brophy Williams. Candace Brown. Michelle Marie Burns. Nareth Carlisle. Laura Cedro. Raymond Ho Ming Chan. Chan Ya Ting. Lucas Chatier. Marte Chati. Hong Chen Chong. Stephanie Yun Yi Cheng. Ali Chisti. Hui Han Cho. Gary Ping Shui Chua. Monica An Yong Chai. Bradley Hunter Crotty. Lucas Detoka. Marisa Leilani Darwardini. Melanie Mansour Dibiasi. Michelle Lee Dossett. Carlos Duarte. Manoj Isau. Adeline Ibrahimi. Anjay Piotr Esmont. Abiola Adebola Fanio. Catherine Marie Field. Philippos Philippidis. Abby Faye Fleisch. Erika Berenice Flores Urube. Charlotte Ruth Gamble. Monica P. Garcia. Tulika Garg. Lydia Gedmintas. Jordan Thomas Flixman. Amy Malia Grace. Ankita Gupta. La Eric Aganda. Kohei Hasegawa. Cindy Seraphin Hatcher. John Thomas Heinemann. David Lerner Hepner. Bobek Heidervi. Leah Shane Honigman. Nancy K. Horseman. Ru Yi Huang. Naoki Ichihara. Mercy Osakpawan Imihir. Matias Irarazabal Dominguez. Hannah Bess Jackson. Andrew Jameson. Hyo Bum Chan. Emily Catherine Johnson. Samantha Ann Johnson. Talida M. Jordan. Ong Ju. Xiao Chu Ruan. Tofik A. Kabani. George Kasatokis. Adil Khan. Aleo Kapidin Kimchi. Rasha Saman Kori. Estra Unsuk Kim. Yong Kim. Kim. Martin Johann Plugel. Sindura Kodali. Jan Mikhail Koschevsky. Amy Suzanne Kravitz. Meng Chon Lam. Grace Qian Li. Jeffrey Ebum Li. Jin Xiu Li. Yun Yong Brian Li. Li Hui Chang. Jeffrey Jia Jun Liao. Li Su. Jonathan Lichkis. Hong Yi Lo. Sadika Mahmoud. Sayed Kafish Mahmoud. Rebecca Wynne Main. Robert Paul Marlin. Stefano Mastrobuoni. Yuko Matsunaka. Lena S. Mehta. Paul Morovich Horvat. Angela McBride. Renisha McCree. Marta Louise McCrum. Marie France Morton McEntee. Hannah Colleen McLean. Paul Thomas Mick. Michael Dean Miedema. Sarah Ann Mahaloff. Edward Milford. Maureen Jane Miller. Rusha Modi. Muizzadin Mokti. Lisa Kenny Morrissey. John Musali. Antonio Moya. Neil Chandra Murthy. Apana Nair. Ji Sun Niam. Susan Nelson. Anne Marie Newland. Todd Eric Oakland. Nebka Obi. Anna Odone. Juliet Sienna Okoro. Uchenna Barbara Okoye. Olufunke Adeboele Aladejo. Emily Ann Oliver. Olutayo Ibukanoru Olubiyi. Olubode Ademola Olufajo. Temitope Jumeke Olukowi. Nkechi Teresa Onwuka. Adebayo Adeleye Owoyeye. Onyinye Ifoma Oyeka. Vikas Pabi. Raveen S. Pale. Ka Yong Park. Lee Park. Shirayu Govind Patel. Lucy Sarah Stokes Pickard. Jose Luis Pilon. Rebecca Milaneski Plank. Ma Bella Paruna Conferada. Shalu Purdy. Julia Ann Elizabeth Raddick. Pudma Sheila Rajagopal. Monica Patricia Ramirez. Tuba Rashid Khan. Alisa Ratanatawan. Giuseppe James Raviola. Angelico Nathaniel Alacon Rasson. Daphne Carmel Remy. Ryan Joseph Rivera. Sebastian Rodriguez Jamazares. Nobuo Sakata. Mary Monica Sando. Abiodun Akim Salako. Natalia Santiago. John Farragon Sawyer. Tusa Rebecca Eleanor Schaap. Christopher Nicholas Schmickel. Lucy Schulson. Hayden Tyler Schwenk. Nicholas Segarin. Victoria Ann Seligman. Eric Jason Seymour. Sujita Shah. Sajid Salim Shahul. Sujata Madhakur Shanbag. Siyi Shan Guan. E. Han Shu. Lara Skordoff. Benjamin Joel Shore. Michael Patrick Shusko. Jesse Amin Sidhu. Simon Skipstead. Trisha Ane Smith. Harpreet Sood. Megan Lakshmi Srinivas. Ramona Elena Florea Stone. Jabaris Damon Swain. Xing Yong Elvian Tan. Wen Tao. Ricardo Mingarini Teha. Olumayowa Tijani Enola. Peter Ting. Warda Sadiq Toma. Russell Clyde Tons III. Michael Richard Ulrich. Juan Carlos Venus. Paul Alfred Vuringa. Hai Bo Huang. Xin Yi Wang. Yi Chen Wang. Neil Jeremy Go Winkun. Chataya Wangratanan. Meng Yang. Yao Zhang. Yen Yen Zhu.
Ladies and gentlemen, the class of 2013, congratulations.
I'd like to ask the graduates to remain standing, because we have one very brief piece of unfinished business. As a sign of your entry into the company of women and men of education and of devotion to service in public health, you may now move your mortarboard tassels from right to left. That small movement symbolizes, though, a major transition in your lives. So I am delighted to be the first one to welcome you to the community of Harvard School of Public Health alumni. A commencement is a beginning. You are now on your way. I wish you the very best on all the adventures that lie ahead you. Congratulations.